Welcome to Fill Up Your Toolbox Chiropractic Technique Seminars. I'm Dr. Paul Hunter, chiropractor. The technique enhancing the cervical curve is applicable to all patients who use their cell phones excessively. I wrote an article about this technique, and it's called Enhancing the Cervical Curve in the Age of Texting. By now, chiropractors, we're all adjusting patients that are suffering the ill effects of excessive cell phone use. It seems it's not the content that's captivating that keeps people using their phones. It's actually caused by the release of dopamine in the brain. This creates a mechanism for addiction, not unlike nicotine or cocaine addiction. Looking down for extended periods, 4 to 6 hours a day is not unusual for excessive users, will flatten the cervical curve. The muscles that support the head and neck will fatigue, eventually fail, and inadvertently strain will be placed in the levels of the spine, of the cervical spine and the upper thoracic spine, where the thoracic kyphosis transitions into the cervical lordosis between T1 and T4. Hypomobility between T1 and T4 will certainly make flexion and extension of the head and neck stiff, but it may also hinder rotation of the cervical spine. Put your hand back and touch the space between T2 and T3, and then turn your head. Certainly that level is contributing to the rotation of the head and neck. We would first adjust the upper back and neck, ribs, upper ribs if necessary, making sure that the area is clear of restriction. Then ask the patient to turn their head to the right and left. If rotation is less than 90 degrees bilaterally, check for the hypomobility between T1 and T4. Palpation between T1 and T4, we're going to use light touch palpation. This finger is static. The head is going to be flexed 5 to 10 degrees in inflection and extension. We're going to feel the inner space, which is going to broadcast the function of that motor unit. The lighter the touch, the more you feel. And we're going to start below where the problem may be and work our way up, comparing each inner space and trying to determine which one of these doesn't belong. In other words, which one is hypomobile, flexes and extends noticeably less than the others. And we're here at T2, and there's noticeable hypomobility. And we're going to target the T2 segment for loris, where it's hypomobile. We're going to have that T2 segment at the top edge of the pelvic panel with the drop piece. And I'm going to cross your arms over the front of you. I'm going to get underneath you and get on the T2 segment and use a broad contact over the patient's crossed arms. You can let the patient know they can breathe normally. I'm going to drop it 3 times, 3 to 5 pounds of pressure. Try turning your head again. How far can you turn? And then the other way. So, significant improvement. Loris, her neck is approaching 90 degrees of rotation, so the enhancing the cervical curve adjustment was successful. You can read the full article about enhancing the cervical curve at fillupyourtoolbox.ca/.com.